So who's a good candidate for an arm lift, brachioplasty? That is basically anyone that has loose skin of the arms. When the arm is primarily subcutaneous fatty tissue and the skin is thick and good skin, typically in younger folks that haven't gained and lost weight, then in those cases, liposuction alone may be sufficient because it will serve to reduce the bulk of the arm and then the skin will be able to shrink pretty well. We can also add sometimes the J plasma to help enhance the effects of lipo. But when somebody has lots of loose skin, and that can happen from aging, weight gain or loss, whether natural with medications or surgery, and if the skin is stretched out and real thin, then in those cases, skin removal with brachioplasty is preferred. Sometimes that is combined with liposuction. If there is some lipodystrophy there, I will actually do both. The type of incision, placement of the incision varies. Rarely somebody might get a mini incision if the laxity that they have is up near the armpit alone. But in most cases, the incision has to go down the length of the arm, and it can go in a couple of different places there. And occasionally it needs to go into the armpit with like a T-type configuration. And in some patients that have real laxity, lots of weight loss, I'll even do an extended procedure where the incision goes down actually the side of the chest, and now you're getting into more than just an arm lift. But all those variations are possible, so I customize each approach to each patient in terms of what your starting anatomy is, what the history is, and then what your preference is for intolerance of the different scars that may be required to achieve your goals.